Welcome everyone to our regular scheduled program this week of the Native Strong Town Hall on the COVID-19 pandemic with Dr. Lyle Ignace of the Gerald L. Ignace Indian Health Center. For those of you who have joined us before, welcome back and thank you for continuing to come and join us week to week. If you'd like to participate, we welcome that for sure by questions. Please kind of get acclimated with your Zoom or Facebook interface here. Zoom, there will be a chat box kind of bubble at the top or bottom of your screen. There you can enter a question or questions as we go through the session, and then we will go through those and hopefully get through as many as we can at the end of the session in our Q&A. If you're checking us out through Facebook, please just drop a comment in there. And again, we will also sift through those as we move along. As we have for the past 15 weeks, our wonderful moderator, Mark Denning, joining us again today. I'd like to say a big thank you to Mark. And with that, I will pass it along to Mark, and thanks again.
Good afternoon, relatives, and welcome. We are many weeks into this, and we are trying to stay ever vigilant to protect our elders, to protect the fragile, protect our families in what's happening out there. In today's program, we're going to be talking about a lot of things. Mostly, we want to talk about what you're interested in. And right now, that seems to be schools. It's a recurring issue. Some of your students are going back to school next week, others in the next weeks in progression. You got a lot of questions, and we don't have all the answers, but we do have informed answers. So as I do each week since the beginning, please be checking in with relatives. Please be asking them how they're doing. Remember that when we have the privilege of time and ability to tune into a program like this, others do not. And sometimes their questions need to be answered just as much as ours do, because they're disconnected from what's happening out there. So that's my way of saying thank you for being with us today, and thank you for viewing this from wherever you are. And if you're out there driving between some of our home reservations, our home cities, our hometowns, our rural areas, be careful out there. I found out that a few of you tune in on this between drive time home, and it's quite a while. So once again, thanks for being here. And Mark Denning, good to see you all again. And I'm going to turn this over to Dr. Ignace, where we begin our program, and he begins sharing information about what's happening in Indian country, information we can use as we travel to our disparate places through the weekends and with our families and travel from here to there. So Dr. Ignace, over to you.
Thanks, Mark, and thanks, Jeremiah. And thank you, everyone, for tuning in again for our weekly event here. Just a quick summary. What I'll be going through is national, international, national, and then focus on updates within the local area as well as within Indian country. And as Mark was stating, that it's that time of the year where we're all thinking about gearing up to go back to school. Some latest information that has come out from the CDC, I'd like to introduce this information and at least give you a perspective as to what we're seeing within the United States in terms of COVID and child hospitalization. So with that, let's get right into updates here. So worldwide, 20.4 million cases, 9.9% increase from the week prior. That's remained relatively stable. In terms of recovered, 12.6 million, 13% increase. That's remained stable as well. 744,649 fatalities, 6.2% increase. That's been relatively stable as well. Here in the United States, 5.2 million cases, 7.8%. That is actually trending downwards and has been for the last 4 weeks. In terms of recovered, 2.6 million, 11%. Number of fatalities, 167, 361, 4.8, and that is trending downwards as well. Here in Wisconsin, 62,263, 9.3%, and that is the 5th week in a row where the percent change has been trending downwards. In terms of recovered, 52,350, 13% increase from the week prior, and the number of fatalities here in Wisconsin, 1,011. It's a 4.2% increase, and that is been trending downwards the last 3 weeks as well. Just as a quick reminder, next slide, there are 573 federally recognized tribes in the United States. It's important to realize that as a native population, there is 5.2 million self-identified American Indians and Alaskan Natives, and approximately 2.6 or half of the population, native population, utilize the Indian health system. That is the federal sites, tribal and urban programs here in the United States. 70% of the native population reside in a urban area. So that's important to know. And as we go to the next slide. So every week I use the data set from the Indian Health Service, and it's probably the best source of information that's reliable in terms of encounters, as well as individual state health department, state health department websites. So let's go through what we're seeing this week. So just a quick view of what's going on. You can see the area of Albuquerque, Billings, Great Plains, Nashville, Navajo, Oklahoma City, Phoenix, Portland, all within 1,000 or higher. And even if you looked at the numbers just broadly and said, hey, that's a lot of numbers, you also got to put that in context and look at the trend of those numbers and how they have been moving over the last several months. So for the week of August 12th, from last week to the 12th, I put in yellow highlights the activity that's been going on within those respective areas. So not every area will be highlighted yellow each week. It really depends on what the trend, at least the number wise, for that week has been going on. So as you go down, you can see what I've highlighted. I've highlighted the Bemidji area, Billings, California, Great Plains, Oklahoma City. These are the areas that have shown high numbers relative to their areas from week to week. And you can see that not all areas each week are the same. So it varies, and it really depends on what's going on from week to week. Overall, you see at the bottom 2,482 cases of coronavirus for the past week. So that's been pretty stable. However, has been trending downwards since July 15th. So as you go across this table, you can see where the percent change has occurred. If you go straight to the bottom, 7.32, that's percent change overall for all of the areas combined. So I just highlight the areas that are above the average, and you can see that Alaska, Bemidji, Billings, California, Great Plains, and Oklahoma City, their percent change is above that average, and some some areas like the Billings area are certainly significant. The percent positive is the number of cases of COVID by the total number of tests being done. For the entire Indian health system, the average is 5.7%. And then you can see how that applies across the board in terms of testing for all the areas. So once we get to the far right column is essentially the trend, and D is for downward trend, a U is an upward, and an F is a flat trend. So at least this week, you can definitely tell there are decreases, downward trends, and then there's upward trends. And in the Bemidji area, there is the upward trend, which I'll be talking about a little bit more. Obviously, Billings, California, Great Plains. Of note is the Navajo area. And so this is the third week in a row where the number of cases are lower than the week prior. So that is certainly great news for the Navajo area. And I know they are doing a tremendous amount of work on mitigating and reducing the transmission of spread down there. Oklahoma City, they are the new epicenter for Indian country, and they're trending out numbers quite high comparative to everyone else on a daily case, but they have been having high numbers ongoing for a full month straight. And much how Navajo was in kind of those early months, Oklahoma is now exhibiting those same types of numbers that Navajo has been. And so Phoenix is trending downwards. Portland has flattened out, and Tucson area is on a downward trajectory. So next slide. What I always like to present is what's going on, at least a little bit more in depth as to what's going on in the other areas that are in the northern aspect of the states. So that top row highlights the Bemidji area, Great Plains, Billings, and looking at what the IHS, the Federal Travel Urban Sites, are reporting out in numbers for the area. So this week, 908 for Bemidji, Great Plains, 1,885, and Billings is 908. Now, in comparison, what I'd like to do is at least let you guys know what I'm seeing from the state's health department websites, and they're reporting out on native data as well. And this really goes back to that comment I made about 70% of the native population reside off the reservation. We know that the majority of federal tribal health centers reside on reservations, and then urban programs, obviously in urban settings. But as you can see in the Bemidji area in the state of Wisconsin, 617, Minnesota 561, Michigan 383, Illinois 273. So those are the numbers that the state websites report out for native cases, totaling 1,834. So what we see in Bemidji area, the federal and tribal sites, the state rolls those numbers up and reports out numbers outside of the Indian health system as a whole. So we kind of get a subset in the overall assessment with the state sites. And you can see that nearly half, a little more than a half of all native cases in the Bemidji area are being reported out outside off the reservation. And so when I look at what's going on by state websites, 1,834 in Bemidji, it's 147 new cases from the week prior, 8.7% increase. And at least for Bemidji overall, we see that trend appears to be going downwards. So Great Plains, same thing. North Dakota doesn't report out on their demographics, so there's no data to report. but South Dakota, Nebraska, Iowa do. Their total is 2,311. That's 108 new cases from the week prior, 4.9% overall increase, and that's been relatively flat. And then in Billings, Montana, Wyoming, so their total number is 1,044. It's 140 new cases from the week prior, 15.5% increase from the week prior of 12%. And so they have this oscillating trend that seems to be going on in the Billings area. So what IHS reports out in data, that's certainly one data set. And then I look at an overview data set from each state that reports out on information and numbers. So it just gives you a much broader perspective rather than just focusing in on just the Indian health system. We have what the states are reporting out as well. So next slide. So this is a quick reminder of all of the symptoms that have been reported out, and it gives the rates of symptoms. So we've all heard that, to be symptomatic, you have to have a cough or a fever or shortness of breath. Well, that was kind of the classic triad of symptoms, but we know that there are a lot more symptoms that go along with this. Now, people can have a fever, they can have a headache, maybe they have just a loss of taste or smell, and maybe they have nasal congestion. From my observation, we've seen individuals that have very mild symptoms, or maybe just one or two of these symptoms, and that's all they have. Some don't even have a fever or a cough or shortness of breath, but they have some other symptoms, and they've turned up positive for the coronavirus. So this is just a quick reminder that there are other symptoms that are associated with having the virus, and not just the ones that we've all heard about in terms of fever, cough, or shortness of breath. So that's a quick reminder. Next slide. So as we look what's going on in the region, this is beyond just the Bemidji area, but this goes beyond. And so I look at all 5 states. And so we'll start with Michigan. Michigan's numbers as of yesterday, 89,271. That's a 5.4% increase from the week prior. 4,564 cases, that's averages out to 652 per day. So they've remained relatively flat, pretty much the same as the week before. In Indiana, 76,522, 9.3% increase. 6,500 cases in the past week, 935. And with respect to Indiana, this is an elevation. They've been up and have stayed up for the last 4 weeks. So they are trending on an upward trajectory. In Illinois, almost 200,000 cases, 6.5%. They were actually on a downward trend, and then over the last 4 weeks, they have crept up and they've maintained that level. It's a little over 12,000 new cases from the week prior. 1,731 cases per day is the activity there in Illinois. In Minnesota, 62,303, 7.8% increase from the week prior. For them, they're trending downwards. 4,500 cases over the past week, 646 per day. They are trending downwards. Here in Wisconsin, as I mentioned, 62,263, 9.3% increase. We are trending downwards, and we have been for the last 5 weeks. And we're averaging about 760 cases per day now. I'd like to change gears a little bit and focus more on the states and the tribes. So as we look at the state of Michigan and the 12 respective tribes, I use the counties as a an indirect measure, although not absolute, in at least seeing what the activities, the activity level that's going on within their respective, the tribe's respective counties. So as you go down, you can see the number, the first number is the total number of cases, and then in parentheses is the number of new cases over the past week. And so as you go down, just a couple changes. The Menominee County, where the Hannahville tribe resides, has shown an upward trajectory. Sault Ste. Marie has, Little River, Ottawa has seen an upward trajectory, and the Potawatomi, Okanagan, and Cass County has shown an upward trend. So in the state of Michigan, 383 cases, 32 from the week prior, that's 9.1%. And they've plateaued, but it is an increased level of activity for the Native population in the state of Michigan. Looking at Minnesota and the 11 tribes in Minnesota, again, the first number being the overall total number of cases, in parentheses is the new cases from the week prior. And we just have a couple areas that have shown an upward. Grand Portage and Cook County, they've had 3 new cases. They've been pretty stable at 2 for quite a while, and then this past week has shown 3 new cases. So in Fond du Lac tribe, 745 overall cases, 140 new cases from the week prior, and at least that county, respective to the tribe, has shown an upward trend in that area. So in Minnesota, 561 cases, individuals, 57 from the week prior, it's 11.3%. And that is an upward trajectory for the state of Minnesota. So, and then, you know, obviously the downward trend, there are several tribes in their respective counties that have gone, that have seen fewer numbers as well. So kind of a mixed bag of plateau, decrease, and some upward trending activity in Minnesota. In Wisconsin, with respect to the 11 tribes here in Wisconsin, we have the counties. Again, the number overall cases, in parentheses, the number of new cases in that county. Slightly different picture. We have several areas that have shown upward trajectory. Stockbridge, Menominee, Oneida, as well as Le Coudray have shown upward trends in the number of cases in their respective counties. Several downward trends in the Forest County, Vilas, St. Croix, and the Potawatomis with their respective counties. So again, a mixed bag. When we look at Wisconsin's DHS numbers, 617 Native cases, 76 new comparative to the week prior, 13.3%, and that's remained at an elevated position for the last 4 weeks. So the trend is been flat, but at an elevated level for the state of Wisconsin. In Illinois, you know, there are no federally recognized tribes, but I do include them given that there is a Chicago Urban Indian Health Center there. 273 overall cases, 30 new cases from the week prior. So they are still very active, ongoing activity in the state of Illinois. Next slide. And this is looking at the state of Wisconsin, the demographics of what's here in the state. 617 cases, as I mentioned. What is new is the number of deaths. There's been 1 new death in the state of Wisconsin, This number has remained pretty stable for a very long time. And so this is the first reported death, at least in almost 10 weeks now, that I have seen in the state of Wisconsin. So hopefully it's not a continuing event. So next slide. This is looking at the demographics by age groups, and I follow this because I noticed the trend probably about 12 weeks ago that at that time it was pretty much even across the board in terms of numbers. But at that time I noticed that the number of cases, the trend was that the younger age group. So I've been following this fairly closely, as you can see, since June 14th. And you can see the rates of cases in the 20-year-olds have gone from 19%, in the 30s 18, in the 40s 16. So they're all pretty equal. And then it started changing and changing. And then about a month ago, noticed another change in the 10 to 19-year-old, or kind of that teenager group, where the rates were increasing there as well. So the trend right now is the younger population, the teenage years, as well as the young adult 20-year-olds. And these numbers have been relatively stable as far as the rate of infections in each of these age groups. I don't suspect that this will change a whole lot unless something dramatic happens. So, and next slide. So as I went through most of the states in our region, it's just not a trend that I'm seeing in Wisconsin, Minnesota, and their age group demographics. Michigan starting to slide more and more to the left, to that younger group. Illinois, you can see, is definitely trending in that younger age group. And then also in Indiana, that age group distribution is pretty true as well. I also looked at 2 additional states, in the state of South Dakota and Montana. Next slide. You can see where that trend is also following that as well, and as well as in the state of Montana. So not just Wisconsin, all the states in our area, in that northern plains area as well, all really are following that same trend that's been going on for the last month and a half. Bringing it back to Wisconsin. So there's kind of 2 things that have occurred, major things that have occurred here. Back in May 30th, we reached kind of that first pinnacle of peaking, and then we started sliding downwards. And then July 4th happened, and we've been increasing ever since. We've plateaued. You can see the bar graphs. There's a level of plateau, and then we've had these intermittent drops in numbers. As you can see, the trend has been going down. It has been going, and it looks like we've probably peaked at July 20th. And then since then, we've been on a downward trajectory. So that's good news for the state of Wisconsin. The 7-day average is now 760 cases. Bringing it back to Milwaukee. So as you look in the center graph there, the city, or I should say the county of Milwaukee, you can see all the yellow circles that this identifies the concentration of cases in those districts. And the city is split by the Highway 94, so you can see the cases in the northern part as well as the southern part and the distribution. There's really no major difference. It's pretty equal throughout the entire county. So there's no significant change in that regard. 21,350 cases in Milwaukee, 394 fatalities. There's been 9 9 individuals that have passed as a result of this. It's a little more than 1 a day. Relatively speaking, to other cities and other regions of the country, that's significantly low. Again, as you can see on the left-hand side, that middle bar graph, you can see the age distribution just as the overall part of Wisconsin. Same is true here in Milwaukee County, that younger age group to 20-year-olds is the higher proportion. And so if we go to the next slide, I want to talk just briefly about the new cases, the new positive cases that are ongoing per day in the state of in Milwaukee County. So I mentioned before, overall in the state, that we had that kind of peak, kind of like towards the end of May. Well, Milwaukee County had a peak May 18th and another peak July 8th. Now that's, several days after the 4th of July weekend. Obviously that's a big mass gathering of family and friends and just get-togethers in general. But as you can see, the trend since then, at least here in Milwaukee, has been steadily going down and down and down. What I thought was kind of interesting, at least in Milwaukee, was that on August 10th, the county had reported out just 19 cases. 19 cases, well, when we look at the overall population of Milwaukee County, 19 cases is pretty small. Now, there may be a delay here of maybe 2 or 3 days before the true numbers come in, but as you can see, since July 8th, the trend has steadily been going down and down and down. So that's good news. I mean, that's good news for the city of Milwaukee, the county of Milwaukee in terms of cases. And that a couple slides before, when you looked at the distribution in Milwaukee County, it's pretty equal, but also the size of those yellow circles was actually decreasing. So we're not seeing that dramatic of in terms of numbers within the Milwaukee County, which is a good thing. That's what we want to see. So when we look at the racial demographics within Milwaukee itself, obviously we see a high population numbers of Hispanics, whites, and blacks who have the majority of cases. And then here on the far right, we have the second from the far right is 84. So that's 84 native cases here in Milwaukee. And that 84, 79, 76, that's just the trend of cases here in Milwaukee. So over the past month, the number of cases here have increased by 34 cases in the past month. So it's still quite active here in the Milwaukee for Natives. Next slide. So I also, as part of this forum, I'm getting inundated with a lot of information, but I'm trying to make it very pointed and at least be informative to this viewership, because we have questions, but we really don't have good, solid answers for people. Like CMS just reported out in terms of who gets hospitalized. And so this was information that the CDC reported, or CMS reported, on Medicare patients who were hospitalized between January 1st to June 20th. So as you look on the left-hand side of this PowerPoint, you can see that the prevalence, or the most common chronic condition of Medicare population that are admitted to the hospital is high blood pressure, followed by cholesterol, chronic kidney disease, diabetes, ischemic heart disease, peripheral vascular disease, and heart failure, AFib. So the reason why I'm bringing out the heart stuff is that a good portion of hospitalized patients have some type of cardiac condition or cardiovascular condition, whether it's directly related to having high cholesterol, having high blood pressure, diabetes, which is associated with increase of cardiovascular disease, chronic kidney disease, ischemic heart disease. That's individuals who've had previous MIs or blockages to their heart muscle that required some type of intervention, either by surgery or stent. And then other peripheral vascular disease. So that would be like individuals like, let's say, have diabetes who have poor circulation to their feet. And so, as we go through this, we see a lot of cardiac, we see a lot of chronic care conditions. And one of the thoughts was that individuals with chronic lung disease would be at a higher risk. But as we see on this graph, a profile, COPD, chronic obstructive pulmonary disease, COPD, and asthmatics are kind of in that bottom tier of conditions associated with hospitalization. So, we're learning more as time has gone by related to the coronavirus. And so what's perhaps more starking is that there is such a heavy emphasis now in terms of hospitalization with people who have cardiovascular disease. And I have my thoughts on why that is, although there's no way for me to prove it, but it's just an observation in looking at it as it relates to the Native population. We do know there's a health disparity in care when it comes, there's a high case rate, or there are a lot of cases with individuals that have high blood pressure, have diabetes, have high cholesterol, have had heart attacks. We have high rates of chronic kidney disease. So, as we apply, as I apply this information that is coming out to our Native population, you can see where the impact can be directly involved to our Native communities. And there may very, very well be someone in your family, whether it be your parents or your uncles or your aunts, that have several of these conditions, and maybe just because they have diabetes. They have high diabetes, high blood pressure, high cholesterol. They may have kidney problems. Maybe they have poor circulation. So, right there, that's like 5 of the top 10 conditions associated with being hospitalized. So we know in our Native population we have high rates of diabetes. So the impact is very much real. So next slide. So in the same report, CMS also came out with hospitalization rates per 100,000. And what I want to draw your attention to is the right-hand side of this slide in the middle section. So as you see, AIAN, Asian, Black, Hispanic, White, and other, these are the demographics that they look at, and the rate of hospitalization for Natives is 505 per 100,000. So where does that relate to other demographics? And so we see the Black population, 670 hospitalizations per 100,000, and the number 2 is American Indians, Alaska Natives. So as I showed in a previous slide, in Milwaukee, the higher the population of cases, so that would be Hispanic, White, and Black. However, when CMS looks at their Medicare population, that's essentially people over the age of 65 generally. In terms of hospitalization rates, we see that just because there are more cases in those other demographics doesn't necessarily translate into necessarily more hospitalization. So, and CMS outlines this as Natives have, maybe as a population, have fewer cases, but our hospitalization, those who get coronavirus that have to be hospitalized, we are the second highest group in terms of hospitalization. So it doesn't get reported out, doesn't get mentioned, but I think it's important to realize based on conditions and this hospitalization report, our native population have to be extremely cautious given our significant diabetes rates in our community. So next slide. So this is a little hazy, but it's important to realize, because I've talked about we've talked about going back to school. What does that mean? What does that mean for our families, for our kids? What have we seen? So I wanted to give information out, at least reported available data information, and so it just gives you a better context as to what's going on, and you can apply that to your own school districts or to your own families and communities. So this slide is looking at the daily cases in Milwaukee County by age group. So we're looking at children between the ages of 5 and 17. What's interesting about this is that there's two, it's a stacked bar graph where you align the total number of cases, but you separate it out by which population group you're looking at. So we have the city of Milwaukee in kind of a yellow-orange, and we have everyone else outside of the city of Milwaukee, but within the Milwaukee County as blue. So I mentioned that kind of that late May we peaked, had that initial peak, and you can see where the number of active cases were ongoing at that time. A greater proportion of kids in the city of Milwaukee had infections. And then as we went down, the trend has gone down. Now, the kids, the number of cases in kids 7 to 17 has not spiked like the state of Wisconsin has, but there's been an upward trend, but it's falling off, and it's falling off towards like July 22, July 23, and then we start seeing this downward trajectory. And it's been going down for the last 3 weeks. So again, and I know families want to know what's going on. We hear about numbers all the time, what's going on. How does that apply to my kids? Is my kids at risk? Are there a lot of cases going on with kids? Well, this kind of gives you a better sense of what's going on in the city of Milwaukee and what's going on in Milwaukee County as a whole when it comes to the number of cases in children, 5 to 17. So as of early last week, you could see that these numbers, they're down. The averages are going down. The overall total number of cases in Milwaukee County have gone down. So if we just look at even August 3rd, you could see the number of cases in blue is about 10. And then the number of cases in orange are about, what is that? That's probably like 18. So we're looking at about 28 kids in the entire city and in the entire Milwaukee County. Again, putting this in context, that's not a whole lot. And when we look at kids overall, what's going on in the county, the trend is going down. Now, I'm not saying kids are not going to get it. No, I'm not saying that. What I'm saying is at least the number of counts that we know that are by lab tests are going down. So at least to give a better sense, maybe a little of relief to everyone, that the trend of kids, especially going into school, at least the facts and this information shows that the trend is going down. Now, the next several slides, they're going to get a little more detail, and I'm not trying to lose people, but this is information. This is a data set from the CDC, so the Centers of Disease Control and Prevention. So CDC puts out their weekly reports, and they talk about public health and obviously diseases that are going on throughout the entire country. So they update with these papers. And sometimes they get very specific, sometimes they're very general, but they want to give you data sets that they are observing nationally in the United States, what's going on. So if you look it up, it's CDC MMWR. This is their Morbidity and Mortality Weekly Report. And this information that I'm going to give you is a release as a descriptive analysis using all available data. So this information looks at not just at demographics, but also looks at conditions and severity, hospitalizations, and clear diagnoses. So less is known about the severity of COVID-19, especially in children requiring hospitalization. So that's what this paper is, and that what I want to bring to you, so you have at least an understanding of what's going on with kids that have a severe case of COVID-19. So we do know that the vast majority of kids less than 18-year-olds appear to have a high significant asymptomatic course or exhibit very mild symptoms. And just as a reference, the number of hospitalizations are pretty low for children. In fact, the latest numbers for children to be hospitalized has a rate of eight kids per 100,000. And if you want to compare that to different age groups, as far as adults, the rate is 165 cases per 100,000 compared to children less than 18 of only 8. So it just gives you a perspective in context of the rate of hospitalization. So it's very low in kids. So how I want to set this up is this was CDC looking at information from March 1st to July 25th. And they use data sets from a surveillance system that they have set up in partnership with several states. And they use the data sets from 14 states for this information. So the 14 states are California, Connecticut, Colorado, Georgia, Iowa, Maryland, Michigan, Minnesota, New Mexico, New York, Ohio, Oregon, Tennessee, and Utah. And I thought this was a bit important because I wanted to, at least Michigan and Minnesota as part of the Bemidji area, their data sets for kids are in this descriptive analysis paper. So, let's get into some of the numbers here. So as information goes from left to right, and they break out each demographic by age group. So let's take the first line of non-Hispanic whites. So they had observed 526 overall in this group. Of that, non-Hispanic whites, 74 or 14% of the kids less than 18 diagnosed with COVID and hospitalized, only 14%. And then it breaks it out. What's the 74 cases? 29 were less than 2 or younger, 5 were 2 to 4, and then 40 in the 5 to 17-year age group. And they go by each demographic, left to right, left to right, left to right. So then we get down to our native population. So there is only 4 cases hospitalized, and of those 4, they were of the 5 to 17-year-old age group. Now, this is not a paper so much focusing on the native population, but it is a paper that focuses on all children that are hospitalized. And so I thought this would be important to put in context as we look at, fears and concerns with kids in the school year and the cases and what's going to happen. And so if we go to the next slide. So in this descriptive analysis of this entire data set, what they've done is they looked at that total population of 526 cases, broke them up by age group and demographic, but then they also did a chart review, and what was available at the time was that they found out that 222 of the 526 children, only about 40% of these cases actually had an underlying condition, had at least one or more underlying condition. So as we go through each line left to right, you can start seeing what these conditions were, and then they break them out by age group. So obesity was a underlying condition, chronic lung disease, asthma, neurologic conditions, immunocompromised conditions, feeding tube dependency, chronic metabolic diseases such as diabetes or other metabolic conditions, blood disorder, sickle cell, cardiovascular disease, in particular congenital heart disease. Now, when I look at this from a physician's perspective, the vast majority of these underlying conditions appear to be like child age underlying genetic conditions or rare conditions such as cystic fibrosis, or perhaps a neurologic disorder, maybe Down's syndrome, or obviously the diabetes would be individuals with type 1 diabetes, cardiovascular disease, congenital heart disease. Typically, kids don't have high blood pressure. They're not dealing with high cholesterol, but they do, and sometimes are, on rare occasions, born with congenital heart defects. And so you can start looking at this entire condition profile, that these individuals are with some pretty significant underlying medical, chronic care, even genetic disorders, or even metabolic disorders that are rare altogether. Now, the one condition that seems to be at the very top of this is obesity. That has been reported out as a condition, and as you can see, now the reason you see the number 42 over 111 is because they didn't apply the 0 to 2-year-olds with their BMI indexes. They didn't apply that, so that cuts a fair portion of kids in this age group. But 111 cases, 42 out of 111 cases identified as having obesity as a condition, 37.8%. So that's pretty significant. And as you see, as you go from left to right, you see the age group 2 to 4, 6 out of 18, 33% of hospitalized kids had this condition. And when you get to 7 to 17, 36 out of 93, 38.7. So if we're talking about all conditions other than kind of these rare disorders and maybe metabolic or chromosomal conditions, what we're really talking about are individuals with asthma or maybe even obesity. And so, that's pretty significant if we're looking at more common across the board conditions that affect anyone, just regardless of any underlying medical disorder. So it's important to see this as you go through this paper. Now, if you go to the next page, this is really looking at individuals by condition, broken out by ethnicity or race. So what we see here are Hispanic and Black children have higher prevalence of underlying conditions. So if we go again from left to right, the Hispanic population, 45.7% of hospitalized kids had at least one or more underlying conditions. And then the Black population with 29.8, white 14.9, American and Alaskan Native 2.1%. So we have a better sense of underlying conditions that are ongoing demographically. This next slide is looking at the reported signs and symptoms upon admission. And as you go through this, you would say, well, okay, of the kids that were admitted and hospitalized, the symptoms were fevers, chills, inability to eat, poor feeding, nausea, vomiting, cough, nasal congestion, rhinorrhea, shortness of breath, abdominal pain, diarrhea. So when I look at this, the signs and symptoms, they say, well, that's not terribly horrific stuff. You know, in the before COVID, you know, we always talk about the cold and flu season, and our kids come home, and what do they come home with? And you know, sometimes they have a fever. Sometimes they, you know, when they do get sick, they don't eat very well. And maybe they have a cough, maybe they have a stuffy nose or a runny nose. You know, that's what 99.9% of our kids would come home with. So there was a good portion of kids that were admitted to the hospital with these very simple, not simple, but pretty non-horrific symptoms of what you would probably feel as just being the common cold symptoms. And so, so overall, 54% had at least a fever. And then you can just go down, you know, cough, 30%, runny nose, stuffy nose, 24%. And getting into that shorter breath, only 22% had that. But then even abdominal pain and diarrhea, kind of smaller, but still on this list. So of the kids that were admitted, hospitalization length of stay. So they looked at 208 kids. The average, the median day was only 2.5, with the younger kids 2 to 3 with the shortest stays, and kids in the 5 to 17 with the longer stay. So that's just a quick look at how these numbers all play out. This last slide gets into the weeds a little bit more. So this is not only hospitalization rates, but this is looking at people who not are just admitted to the hospital, but need to go into the ICU. So as we go through this, I just want to highlight a few of the numbers, and at least what I'm observing, seeing here. So of the 208 cases that they had done their chart review and looked at very closely, only 69 of those, or 33% of kids admitted to the hospital, had to go to the ICU. What's interesting is their length of stay in the ICU is very short as well, only 2 days. 1 day for the 0 to 2, and then 3.5 days for the 5 to 17-year-old group. So usually when you go to the ICU, it's usually because you need a higher level of care that they can't offer on the general floor. So what does that intervention look like? So invasive mechanical ventilation. So that would be someone who would require intubation, and is a bit of a last resort to assure people can maintain and breathe effectively, that can sustain their body during this illness. if before intubation, before being put on a machine, there are other interventions that can be used, and that's called BiPAP or CPAP. And these are basically mask and different pressure settings that you could put over the mouth and nose with a good seal, and based on the pressure and how the pressure is delivered, you can sustain someone's good oxygen flow through their lungs without having to intubate them. And then we have high flow nasal cannula. That's basically oxygen under the nose. And then some of the other interventions such as steroids, IVIG, and vasopressors. So these are other modalities that can be used to help support people during their illnesses. So, but in terms of serious intubation or respiratory collapse, mechanical intervention in BiPAP or CPAP, again, the numbers are pretty low. So kids get sick, they may require hospitalization. They may just do fine with some supportive, but even if they do go to the ICU, it's a relatively short stay, and even fewer require this high level of mechanical or breathing machine ventilation. So that's that top half of that data set, and then on the bottom half gets into the more specifics in terms of the diagnoses. So pneumonia being one, acute respiratory failure, acute kidney failure, diabetic ketoacidosis, ARDS or acute respiratory distress syndrome. So these are these discharge diagnoses that are given to as what happened during their hospitalization. And so of all of these kids who were admitted and sick, so we're talking a total number of 576 in this 14 states during this time period. All of the admissions, all of the ICU admissions, how they're broken out, and the diagnosis and what was done. The number of fatalities of all of this was 1. So, and that was an individual. The paper does not describe the individual per se, other than this is someone that had multiple underlying conditions that required hospitalization. So we don't know which type, but the fact that this individual had multiple and obviously had succumbed to the virus. So unfortunately, but overall, when we talk about numbers, one individual of 576 is a pretty small number of individuals. So I know that was an in-depth kind of overview of this paper, but I think, when we talk about severity and the scale of children and how they are affected by this, we know kids can certainly have the coronavirus. Most have a pretty benign course. We do know kids can be asymptomatic, or if they do have symptoms, they're very mild. Even moderate symptoms don't require hospitalizations. But in that subset, small portion of cases that actually do require hospitalizations, these kids actually fare pretty well. They do very well, even if they have multiple conditions. I'm assuming the ones that don't have any underlying conditions actually do quite well and not even would be admitted. So it's just important that when we talk about and hear about hospitalizations, we hear about kids, and obviously we want them to be safe. During this time, we want to minimize rates of transmission. This just gives you a better sense of context as to overall not only the risk, but also the safety, and what are the the prospective outcomes, and even if you do get hospitalized, what kind of what can we expect to see? And so I hope this helps. I know it was in depth. It is pretty heavy in this discussion, but I thought it'd be important to bring this out and at least speak to it to a point that people can at least see the numbers and come to their own conclusions as what they see. So I'll stop there. I do want to give some time to some questions. So what I'll do is, if we could turn this over, maybe I'll talk about the getting tested. So as I mentioned, the signs or symptoms: fever, chills, cough, short of breath, runny nose, stuffy nose, rhinorrhea, nausea, vomiting, GI pain, loss of smell, loss of taste, body aches, extreme fatigue. If you suspect or feel that you have one or more of these symptoms, please don't hesitate to call us 414-383-9526. We could assess and evaluate your symptoms and look at setting up a date and a time when you can get tested. So with that, I'll end it, and I'll turn this over to Mark and Jeremiah to address any questions that may come up. You're on mute, Mark.
So thanks for the perspective on the students. One of the questions I had during the week from a teacher was in the school, certainly they're going to be running into more people than they're usually in contact with, meaning maybe there's a student or substitute teachers coming in and out, volunteer helper or someone that helps in the class, food service staff, that kind of thing. So as they're kind of preparing themselves going into the school year, the question was, and it does, and I understand that coronavirus has different effects with different people. But in a general sense, a teacher going back to school, and let's say they do get corona, about how long is a person going to be out in general? And because they're going to be making lesson plans, and they're going to have substitutes coming in, and they're going to kind of want to have a general sense of what that classroom needs to be prepared for in their absence. So kind of what's your sense around that for that younger teacher, let's say in that 24 to 40-year-old range, get COVID-19 and they're out. So what are they going to be looking at?
So the CDC has put out guidelines and recommendations, and they've looked at individuals of infectiousness from testing, antibody testing, antigen testing. And so from time of diagnosis, I think everyone should anticipate being out for 2 weeks, 14 days. And the reason why I say that is there are individuals who may get coronavirus and have a relatively short course of it, which means maybe I feel bad, I get tested, it comes back positive, I have a low-grade fever, maybe I have a cough, maybe I have a sore throat, but within 72 hours, they're completely back to normal. Now, and everything is gone. Everything's back to normal. There are people like that, and then there are certain individuals who have prolonged courses, who have the extreme fatigue, the cough that never seems to go away. They lose their taste and they lose their smell, and they just feel horrible. And they wish they could have it over in 3 or 4 days, but they have these prolonged course. Now, in either subset, whether you have a short course or whether you have a prolonged course, the infectious aspect of both of these groups takes about 10 days on the average to render people not infectious. 10 days. So we know people have a short course, some people have a prolonged course, but in terms of infectious, it's about 10 days, 11 days, and then they would be either deemed okay or non-infectious and okay to come back to work. So how long for any individual, regardless if you're going to be on a short course recovery or a prolonged course recovery, that's not so much the issue as it is how long do you expect to be infectious? And it is about 10, 11 days. So I would anticipate just plan on being out for 2 weeks, 14 days.
So let's kind of shift gears over to being an administrator at that same school, interacting with lots of adults. That short course is hopefully, if it does happen, they have a short course term. And a lot of administrators, because of their jobs and they're not in front of kids, it's not fast acting sorts of, managing students. And I've not read or seen anything about this, but just in your experience, what about decision-making skills for patients? Are there things that maybe that administrator needs to be thinking about and saying, maybe if I am not going to be participating and present at the school, there's a period of time or things I need to be looking at where I shouldn't be in those decision-making conversations, or is this just kind of, it's a virus we're familiar with and it's taking just fluids, and I'll just let you weigh in and with a thought about that.
So, if we're talking administrative individuals and administrative work, the day-to-day work, I would just anticipate being, those first 3, 4, 5 days just being sick leave, which basically means you're out. And you have your deputy or second or someone designated to just be in your place until you're off of sick leave. So, given this time where we have, all of the social media platforms to be able to meet or Skype or Zoom or Doxy.me or whatever, so we have these abilities to interact and communicate even in a non-face-to-face meeting or group session. My sense here is that if you have coronavirus, you do get sick, just call it a sick day. If it's another day, that's fine. If it's 3 days, that's fine. What the important thing would be is make sure you get your rest and you recover, and you recover as quickly as you can. But from an administrative standpoint, beyond that, hey, I'm better, I'm okay, I can function, I can do things. After those first several days of being sick leave, you still need to be at home, but you can still do things from home. And you don't have to be physically at your work location to do those duties. So that's how I would split those out, where there would be obviously days, sick leave days there, but once there's a point of recovery and at least a sense of being able to perform your duties, I think you could work from home and within that 14-day time block, as I mentioned before.
So another perspective with the school day is van drivers, the short buses that folks will use, as long as the big ones. Drivers, if they're full-time, they're usually doing morning, afternoon routines, meaning, of course, in the morning, they're picking up young people. The middle of the day, they're kind of at break. And then the last part of the day where they're picking folks up. If you have that kind of work shift, meaning a division in your day where you're picking up kids, there's that break, and then now you're picking up more kids, what would you recommend for that driver? In that in-between time, what should they be doing to keep themselves healthy, clean, staying on the job and making sure they're okay. Would you make any recommendations for them that have that where their bus, driving ends? I know you're seeing what I'm saying, maybe where I'm headed. They got some time at home and then they're back out on the road.
So, I think as we all have taken our new routines to a new level and all of our precautions that we take, I think this really comes down to maintaining that social barrier, reducing or limiting your social gatherings, maintaining hand washing, disinfecting wipe downs, and wearing the mask. So again, it is really about maintaining that high vigilant level of staying safe. And what does that mean? So, hand sanitizer, soap, washing your hands, wearing a face mask, maintain your social distancing more than 6 feet, and limiting, any high risk activities. I think this particular, if it's a driver we're talking about for routine routes, morning and afternoon, in between and after, I think if we all maintain this level, this new level of normal, I guess, they should do fine. They should do fine, just like they were doing fine before before having to drive, twice a day. So maintaining this level, individuals should do fine.
Just to follow up on that one, what about changing clothes? Anything around that, or you think they're gonna, basically they'll be all right? I remember when we first started taking on this subject, there was an idea that, hey, if you're coming to the door and you are outside and in contact with folks you don't know, you need to be kind of stripping at the door, getting those clothes in the wash. What are your thoughts about that?
So I think if I would still maintain that type of level of routine. So obviously I work in a clinic and I'm exposed to the building and its environment and traffic that comes through. I see patients, and so I have my work clothes that I wear. So when I come home, that's completely, changed out every night and washed. I think when we're talking about, in this case, I think you're talking about employees that work at a school and their routines that may have interruptions. I would just maintain the same clothing until they go home, and then that's where you do that exchange. I don't think they need to go to such lengths in between. In this particular case, the drivers, I don't feel they need to have that turnover for the next, half-day route.
And this one I'm going to turn over to Jeremiah. He's got a question here about higher education, in that a lot of UW system, certainly all of it is going online for this upcoming semester. But there are smaller colleges that will be in session. And Jeremiah, if you might weigh in on this one.
Yeah, sure. Thanks, Mark. So we just had a question coming in from Facebook just regarding college students living in dorm rooms, small space, in and out of the dorm rooms all day. What would and I think this kind of goes along with just what you were talking about with Mark here and driving and kind of in and out of the house and stuff like that. But what would you suggest as a good routine to maintain cleanliness?
Yeah, so, I'm sure each school, each university, college are going to come out with their own guidelines and recommendations. I think as a general rule, it's going to be important that students maintain a mask or covering all the time when they're out in the public. I think washing your hands is going to become quite frequently. You're going to be in and out of buildings. You're going to be in and out of classrooms. You're going to be handling not only desks, chairs, laptops, phones, doors, you're going to be passerbys of hundreds of other individuals doing the exact same thing. So I think in terms of being in the public arena, not outside of your dorm room, out in the public, in the interacting of college campus day to day, obviously it's the mask covering that's going to be the most important. I think hand sanitizer is going to be the second most important. There is a fairly high level of comfort knowing wearing a mask or wearing a covering and being in a social or classroom setting that you could maintain that enclosed space for a period of time and feel a level of comfort or protection in that regard. So, when you're outside of the building, in the public, outside where, maybe you could probably have some relief by, maybe not having to wear the mask so diligently. But I think when you get back to your dorm, I think you got to look at your dorm or your room as being essentially how you've been doing while you've been at home. I think you still have to maintain those same routines, which means some dorms have cafeterias that feed their kids, not the kids, the students. I can't call them kids now that they're not in college. So the students have dorms, residential, as well as a cafeteria. So, being in an open public setting in a cafeteria may seem really weird when you're wearing your mask and trying to eat at the same time. I don't think it would be safe not to wear a mask in a huge setting like that when there's hundreds of other individuals in the same immediate area. And that you may have to feel a comfort level there, whether you feel comfortable eating there in that, or maybe I don't remember when I went to school, did they allow us to take food out of the cafeteria? I don't remember. But if that's an option, maybe that's an option where you feel more comfortable eating in your own dorm room. Maybe that's a possible solution. But I think when you get back to your dorm room, I think you could kind of consider that as being your safe space. And as in, you'll still need to kind of follow the disinfectant and the cleaning and the doorknobs and the hand sanitizers and the clothes that you wear from being out in public to now being in your room, changing those out. I mean, just as you would do normally right now, what you do at home, I think you should still follow that same pattern or routine when you get to the dorms in the college setting. So I hope that helps. I know each school may have different recommendations and guidelines. I'm not sure how they're going to figure out that cafeteria thing, but, universities, colleges, they're going to have to figure that out somehow. I don't have an answer for that one.
So just my last question, because we're coming to the end of our time. This is kind of a teacher-focused one, and I remember this when I was teaching. A lot of parents out there, they got their kids, of course they got to work, a single parent house or even two family. It's tough making it out there. I don't care what's happening. And a lot of times when their child gets sick, they're going to give them Tylenol. They're going to give them some kind of something to lower that temperature so they can get past that front desk. Because at the front desk, and that's just reality. They're going to be raising up a temperature. There's going to be this line of young people coming in and out of the door, trying to respect social distance. But that means that Tylenol has a shelf time working on that young person. And the teachers really got to be aware of what's happening. So my question from the teacher perspective, and this is a real perspective in a real classroom, parents are gonna try to do this, and of course they shouldn't. But what is that teacher looking for, like any secondary signs, or what is it that they're kind of especially, the word you use is vigilant
Yeah.
looking at the young people in their classroom when they're sitting back from their lesson plan, and now it's their chance to observe what's going on. What would you recommend for that?
Yeah. So, you know, there isn't going to be one particular thing, but, you know, I would look for, if I was a teacher, I'd be the one looking for the one that's coughing or sneezing in their mask kind of thing. These would be the individuals I would be kind of like my head would turn and focus in on those individuals. Because coughing and sneezing are basically the essential ways of how we would transmit it, you know, projecting and so forth in the air. So fevers you can mask. You can kind of get away with, you know, little Johnny not eating much for lunch that day. But the coughing, the sneezing, the runny nose, those would be the, I would say, hallmarks as to say, hey, we need to look at little Johnny a little closer here. Maybe we've got to sneak and do a sneak temperature check on him when he's not looking. So that's, you know, and I think teachers need to be mindful that, not as a punishing thing, but I think, you know, random surveillance checks of high suspicion individuals, I think would be appropriate throughout the day. You know, maybe schools may do kind of a pre, you know, check-in screening when they come into the building, but we know kids get sick. They could flip on a dime and get sick 2 hours later with a fever, and so, but if there isn't, or masking, or a reducing of the fever by Tylenol or ibuprofen, but you can't really hide those other symptoms of coughing, sneezing, and a runny nose. Can't really mask those. You can't hide those as kind of being symptoms, additional symptoms other than just a fever. That's what I'd be looking for.
The suspicious characters sitting in their little desks 4 feet high and under or over. But it is true. And thank you for that honest answer. And I think teachers will appreciate that answer.
I think random surveillance checks, I mean, you know, they don't have to be, you know, thermometers in the mouth thermometers, or even the ear ones. They have the contactless thermometer checks where you can just, you know, place it, you know, don't even have to touch the skin to check a temperature. And you know, that would be a quick way to say, hey, give me 5 seconds to do your temperature. And maybe each room should have one of those types of devices.
Okay, thank you, Dr. Ignace. We're at 4:30, and as we close each of our programs, we're going to give you the last bit of message for our community. And thanks to everyone out there for being a part of this program once again. Be talking with your relatives out there and bringing questions to next week's show. Milwaukee is going to be very busy next week. The Democratic National Convention is in. There's lots of new people from lots of new places coming into the city. And just a short word, Gerald L. Ignace Health Center is helping with a fire that we have that's going to be burning for all our communities at the Old Concordia campus, which is now the Potawatomi, right in the middle of the city, about 33rd and State. So we'll be thinking about everybody out there. 4 days of fire, 4 continuous nights. And stay safe, everyone. Dr. Ignace, your final message.
Thanks, Mark. And I you know, the kind of takeaways I hope people get from today's event is really trying to put things into context. I know we get bombarded with media and numbers, and you know, what does that all mean? What does that mean to you as an individual, your family, to the Native community? So in these presentations, I give kind of these hallmark areas of context in the setting of what the numbers actually mean to you. What does that mean to your family? What does that mean for my kids who are the issue of school is going on. And what does that trend out? What does that actually mean? Is it safe to go back? If they go back, does that mean, what do we do? How do we do it? And at least give you some reassurance that I'm not saying coronavirus it's inevitable that there will be cases. And I'm not saying there will be no school cases, because there will be. Without a doubt, there will be. But I think I want to at least give the information, so to give at least peace of mind that the virus, for the vast majority, individuals are going to do quite well. And even if the individuals that do get sick, especially kids 18 and younger, do fare very well. And so obviously be vigilant, be cautious, but do put everything into perspective when it comes to not only your family, but also your kids. And so that's what I hope, and that's information that I can get out and allow people to be better informed to make decisions. I'm happy to do that, and I hope I'm successful in doing that. So next week, we'll certainly be discussing more items and more issues that come up. And so till next time, stay healthy, stay safe, and